Next speaker is my close colleague from the Department of History and Philosophy of Science, Steve John, who's a lecturer in the philosophy of public health. And he'll be talking about, it all depends what you mean by public, the relevance of philosophy to public health research and practice.
Good afternoon. Well, thank you to the organisers for asking me to speak. I should say, I don't know if I lack a Y chromosome or if I'm just making an effort to improve the male per capita number of slides, but I don't have any slides. You'll just have to look at me. Okay. So, as the audience in this room knows all too well, public health research and policy making can be extremely contentious. There are controversies over the ends of public health policy. Should we care about overall health, or should we care also about health inequalities? There's controversy over the means of public health policy. Is the current health promotion agenda overly paternalistic? There's controversy over the relationship between public health research and public health practice. Is it unreasonable to demand policies are always based on randomized controlled trials? Or is it unreasonable to base policies on anything other than randomized controlled trials? So what's my job? Well, my job as a philosopher is to provide better ways of understanding such problems. Now, you might think that sounds like rather a modest aim. In fact, you might think it sounds rather useless. Because you might think what we need are answers, definite answers, not better understanding. But you'd be wrong. and surprisingly, I'm going to say that. Why would you be wrong? You'd be wrong because answers are only as good as the questions we ask. So imagine I'm a tourist in Cambridge, and I ask you, how do I get to a station? You say, oh, it's just down there by the War Memorial. I say, oh yeah, what a definite answer. So I go off to the War Memorial, and I think, oh, I should have asked. Where's the bus station, not the train station? Okay, it's my fault. I asked a bad question. And what I want to suggest today is that what's true of helping tourists in Cambridge is also true of thinking about public health research and policy making. It's only if we ask the right questions, which is where philosophy comes in useful, that we get good answers. So specifically, what I want to show is how the driest, most apparently useless aspect of philosophical work, making subtle distinctions, might help us understand very pressing problems around screening policy. As you know, although screening policies undoubtedly save lots of lives, so I'm thinking about, let's say, cancer screening policies here, they're also extremely controversial. There are constant debates over if we should have such programs at all. If so, if we should change the eligibility criteria, changing the age range, changing which risk factors we take into account. If we're going to have such programs, how should they be implemented, and so on. Now, in having such debates, we could separate out at least two forms of controversy. First, debates over the ends of screening policies. To put it very crudely, do the benefits of, let's say, routine breast cancer screening, saving so many lives per year, outweigh the costs in terms of needless mastectomies, needless worry, and so on. Second, there are debates over the means of screening policy, the ways in which women are invited to screening, for example, we might worry they distort women's ability to make an informed choice. Now, philosophers can, indeed they have, helped with both of these debates. The first kind of debate over the ends of screening policy clearly relates to an ancient philosophical debate, at least a very old one, over utilitarianism, the doctrine we should always aim for the greatest good for the greatest number, which seems to imply that sometimes we should be willing to forego large gains for a few, having their lives saved, in return for comparatively modest gains, avoiding needless worry for the many. The second sort of debate over inviting women to screening, for example, again relates to a very familiar philosophical debate over the difference between making an offer and making a threat. Now, what I could do now is I could tell you about these big philosophical theories, and then I could tell you how they relate to the screening debate. But if I did that, you'd have to take a lot on trust, and it would also be kind of dull. So instead, what I want to do is I want to take you to the cold face of philosophy, so to speak, to use a silly metaphor for philosophy, and show how actually doing some philosophy can help us better understand our case study. What do philosophers do? They spend a lot of time worrying about distinctions, worrying about subtle distinctions. What's the core distinction for thinking about public health policy? I think it's in the name of a discipline. It's a distinction between the private and the public. But what's the distinction between the private and the public? Well, what I want to suggest is there's not just one distinction here. There are many distinctions because private and public can qualify many different types of things. So here's an initial distinction. We might distinguish between public decision-making interest, and private decision-making of individual citizens guided by their own interests. And it seems clear that what might be reasonable decisions at one level need not be reasonable decisions at a second level. So according to many economists, it makes sense for governments to run a deficit, but it doesn't make sense for individual households to do the same. Distinction one, we'll come back to it. Distinction two, I might distinguish between private communication and public communication. So consider a love letter. A love letter is a piece of private communication. It's explicitly directed from one person to a particular second person. Consider by contrast a government anti-smoking campaign. It's a piece of public communication. It's directed to all smokers, not any particular smoker. And again, what could be proper or right or useful in private communication may be improper or useless in public communication. If you write a love letter, you might refer to your lover as my darling. But if the government referred to smokers as my darlings, they'd be in all sorts of trouble. Yeah? Again, that's a sex distinction. In terms of communication, we'll come back to it. But that's not the only way we might distinguish private and public. Here's a third distinction. We can distinguish between private identities and public identities and how these relate to the claims we make on other people. This is more abstract, so here's an example. In the private context of my family, I have an identity as a Welshman, okay? And as such, I can ask my wife to sort of, look after the baby while I watch the big match, which I enjoyed greatly. But in my public capacity as a citizen, I can't say to the state, let me off jury service so I can watch the big match. The identity is irrelevant in the public sphere. Okay. Now, I could carry on listing private and public distinctions all day, but I'm not going to do that. Rather, what I want to do is I want to now show how having made these distinctions, which are kind of everyday distinctions, you don't need to do lots of philosophy to get what's going on here, relates back to our case of screening. So first, different forms of decision-making, private and public decision-making. Now, often people are very quick to move from the claim that the breast cancer screening program saves lots of lives overall, to the claim that individual women should take part in the breast cancer screening program. Alternatively, they're very quick to move the opposite direction. Sometimes people say that the fact that for some individual women, the individual risks of cancer screening outweigh the individual benefits means a state shouldn't be offering such programs. Now, simply by distinguishing private and public decision-making, we can see why those kinds of debates are futile, because they're ignoring the fact that a rational societal decision may not be the same as a rational individual decision. Why is that useful? Well, here, look, it gives you one reason why screening should be optional, not mandatory. I mean, a better reason than just saying, oh, choice for gender. It should be optional because making screening optional provides us a way to recognize the gap between the individual decision and the social decision. What about forms of communication between private communication and public communication? Well, as many of you know, when people discuss screening programs, they often talk about problems of risk communication, of how the public misunderstand risk and risk information. But if we make the distinction between private and public communication, we could realize that some of these problems don't just stem from public misunderstanding, so to speak. Rather, they might stem from the fact that GPs and other medical professionals are in a very interesting, ambiguous situation. Because although they're in a typically private situation, they're talking to one individual, they're typically doing so using government data, which is intended for public consumption, data about average risk, for example. So what might be going on here is that GPs face a very difficult problem. Should they be guided by the rules and norms which govern private communication, or those which govern public communication? The third distinction I drew was between types of identities. How does that help us here? Well, look, there are various ways in which we might improve the accuracy of screening programs by using different kinds of information, incorporating different risk factors. But look, it's interesting to note that when we use such information, we're not just using information. because we might also be recognizing certain sorts of identities, for example, ethnic identities, as public identities, as identities which are the basis for valid claims on the state. And even if such recognition has gains in terms of accuracy of screening, it might also have social losses in terms of solidarity, in terms of fairness. So again, recognizing that screening is a public activity suggests that we can't just reduce all our questions about which categories to use just to questions about the outcomes. We also have to consider the kind of public meaning of recognizing certain identities. Okay, so to summarize, what I hope to have done is I hope to have shown how distinguishing just three senses of public and private in terms of decision-making, in terms of communication, in terms of identity, can help us to realize some of the complexities which lie at the center of these debates over screening. What I haven't done is given you any answers, okay? But just return back to the analogy of a lost tourist. So imagine, you have a lost tourist. They say to you, sorry, how do I get to the station? And you respond by saying, sorry, do you mean bus station or train station? You've done something useful. And what I hope to have suggested is that when a philosopher says to you, sorry, what do you mean by public? They're also doing something very useful. They're helping you formulate your question in better ways, which allow for better answers. Thank you very much.